Aphasia is an inability to comprehend or formulate language because of damage to specific brain regions. The major causes are stroke and head trauma. Aphasia can also be the result of brain tumors, brain infections, or neurodegenerative diseases, but the latter are far less prevalent. To be diagnosed with aphasia, a person's speech or language must be significantly impaired in one, or more, of the four aspects of communication following acquired brain injury. Alternately, in the case of progressive aphasia, it must have significantly declined over a short period of time. The four aspects of communication are auditory comprehension, verbal expression, reading and writing, and functional communication. Aphasia affects about 2 million people in the US and 250,000 people in Great Britain. Nearly 180,000 people acquire the disorder every year in the US alone. Any person of any age can develop aphasia, given that it is often caused by a traumatic injury. However, people who are middle-aged and older are the most likely to acquire aphasia, as the other etiologies are more likely at older ages. For example, approximately 75% of all strokes occur in individuals over the age of 65. Strokes account for most documented cases of aphasia. 25% to 40% of people who survive a stroke develop aphasia as a result of damage to the language processing regions of the brain. Aphasia is most often caused by stroke, where about a quarter of patients who experience an acute stroke develop aphasia. However, any disease or damage to the parts of the brain that control language can cause aphasia. Some of these can include brain tumors, traumatic brain injury, and progressive neurological disorders. In rare cases, aphasia may also result from herpesviral encephalitis. The herpes simplex virus affects the frontal and temporal lobes, subcortical structures, and the hippocampal tissue, which can trigger aphasia. In acute disorders, such as head injury or stroke, aphasia usually develops quickly. When caused by brain tumor, infection, or dementia, it develops more slowly. Substantial damage to tissue anywhere within the region shown in blue, on the figure in the infobox above, can potentially result in aphasia. Aphasia can also sometimes be caused by damage to subcortical structures deep within the left hemisphere, including the thalamus, the internal and external capsules, and the caudate nucleus of the basal ganglia. The area and extent of brain damage or atrophy will determine the type of aphasia and its symptoms. A very small number of people can experience aphasia after damage to the right hemisphere only. It has been suggested that these individuals may have had an unusual brain organization prior to their illness or injury, with perhaps greater overall reliance on the right hemisphere for language skills than in the general population. Primary progressive aphasia, PPA, while its name can be misleading, is actually a form of dementia that has some symptoms closely related to several forms of aphasia. It is characterized by a gradual loss in language functioning while other cognitive domains are mostly preserved, such as memory and personality. PPA usually initiates with sudden word-finding difficulties in an individual and progresses to a reduced ability to formulate grammatically correct sentences, syntax, and impaired comprehension. The etiology of PPA is not due to a stroke, traumatic brain injury, TBI, or infectious disease. It is still uncertain what initiates the onset of PPA in those affected by it. Epilepsy can also include transient aphasia as a prodromal or episodic symptom. Aphasia is also listed as a rare side effect of the fentanyl patch, an opioid used to control chronic pain.